This is Dr. Gary Bellman discussing erectile dysfunction, and this video will focus on the medication that's commonly used. The first message I would have is try to avoid those supplements that one sees in the gas station or the health food store because the quantity and the quality of products is not controlled. Some of them have small amounts of viagra, Cialis, and generally they're not consistent and the quality is low. The second message, if you are going to explore these medications, make sure that you use a good quality pharmacy, a brick and mortar pharmacy, a good online pharmacy, or a good compounding pharmacy. Avoid buying these products from third world countries. And the take-home message about these medications is Viagra is the most commonly counterfeited drug. And if the price seems too good to be true, then it probably is. The medications are Viagra, Cialis, levitra, and stendra. We seem to use majority of times Viagra and Cialis. The medications now are generic, and certainly the cost has gone down. Cialis is 5 milligrams, 10 milligrams or 20 milligrams, and the sildenafil Viagra is 50 milligrams or 100 milligrams. It's important to take these medications in advance, at least an hour and a half or 2 hours. There are lozenges that can be absorbed sublingually or bypass the stomach, and these can often work in a quicker fashion. But these medications, usually if they're taken orally and absorbed in the stomach, have to be taken a solid 1.5 to 2 hours longer prior to sexual activity. For younger men, or they haven't tried, I usually try Cialis first. Cialis has less side effects like facial flushing and headaches, and seems to linger in one's body longer, last longer. Viagra has more of those side effects, but can be a little bit stronger. Men who are diabetic and have tried Cialis, certainly Viagra is a good approach. These medications can also be taken in a daily fashion. Specifically, Cialis can be taken in a daily manner, and many men function well on a daily Cialis, and some men require an additional medication. The take-home message from this is medication can be very helpful for erectile dysfunction. Make sure you're taking it safely from a qualified, safe source, and dealing with a medical professional who can guide you in its use. And lastly, men worry about a tolerance or dependency. I don't really think that's true. Men worry if they start taking these medications, they're going to be dependent on it. I don't believe that's true. This is used when men need to have some assistance to function in a manner that they want to. Thank you very much, Dr. Bellman.